Returning this week is Dr. Russell Sampson to talk about peripheral arterial disease, or better known as PAD. Welcome back, Doctor.
Thank you. Thank you for having me.
Absolutely, absolutely. So what is PAD? I know you said a lot of your patients recognize that more than the long term.
Right, PAD,
yes.
Or peripheral arterial disease. So people know about coronary artery disease, where they have blockages in the arteries to the heart. But that's just one manifestation of blockages that can occur anywhere in your body. Very common in the heart and causes heart attack.
Okay.
But I think a lot of people now realize that you can get it elsewhere in the body. And the main area that you can get it is in the arteries to the legs. And since the legs are far away from the heart, that's why we call it peripheral and arterial, because it affects the arteries, not the veins. And it's blockages in the arteries to the legs.
And what causes that?
Same type of thing that causes blockage in the heart arteries. It's called atherosclerosis, or fatty deposits. People know plaque that develops. And so, you know, why you get it, it's a buildup of cholesterol, calcium, fats that starts to develop in your body, usually related to smoking or diabetes or just bad diet. And ultimately, when you get it in the legs, it can cause symptoms. And the usual symptoms that people get in the legs are difficulty walking. Patients will tell me that they can walk about 100 yards or so, and then their legs start to become uncomfortable and heavy. And they feel like they have to stop, and as soon as they stop, the pain goes away, and then 2 or 3 minutes they can start walking again. And there's a medical term for that. We call it claudication. But really, it's just pain with walking that goes away when you stop and comes back when you start again.
So pain like shooting pains, or is it like you said, a heaviness? I mean, that's
those are good questions. No, it's not a shooting pain. It's usually in the calf muscles.
Calf muscles.
Can sometimes be in the buttocks. And it's a heavy aching thing. It's like, I'm sure everybody's had an experience when you've gone for a very long walk, or you've climbed up a flight of stairs and your legs just feel tired and achy. That's the type of pain that they have. But sometimes it's been quite severe. Sometimes people really, the pain can develop so strongly that they really feel an intense pain.
And how is something like that diagnosed, other than, I mean, obviously if you have the pain, but can it go undiagnosed? It
does. The majority of people who have PAD don't know that they have it, because they can have narrowings and blockages, but they don't walk far enough to get the discomfort, or the blockages aren't bad enough to cause the discomfort. So what we recommend for people that are at risk, and we can talk who those people are, but there's a very simple test where we take the blood pressure in the ankle. And if you've got a blockage in the circulation down to your lower leg, then the blood pressure will be low in the ankle. And we use a device called a Doppler. It's a little sound device like a stethoscope.
So it's not painful, it's a simple...
Very simple test, takes 5 minutes.
All right.
And that will tell you whether you have it or not.
And how is it treated? Once you find out, what is the treatment for it?
Well, the majority of people, we just tell them to exercise and try and get into a walking program and improve their endurance. But we like to get rid of the risk factors, which I think is something we'll talk about at a different segment. But there are treatments for this. They can be as simple as what we call a balloon angioplasty, or a stent.
Which is something you also do on the heart. So there's same type of
thing, except we do it in the legs.
Now, are they, you know, because we think of the heart as being a much more risky part of the body to treat. So are there as many risks? Are there less risks to something when you're treating the lower part of your body like that, your lower extremities?
Anytime a doctor touches you, there's a risk.
Of course.
But the risks are less than when you have it in the heart. But it has to be done by a specialist. And the usual specialists are vascular surgeons, because sometimes you can't do a balloon procedure, and then you actually have to replace the artery. So just like someone has a replacement in an artery in the heart, we do replacements of arteries in the legs, and that's called a bypass operation. Not a heart bypass, but a bypass in the leg.
And you get those from other parts of the body?
We do. We take the patient's own vein that's in the leg, we turn it around and use it as an artificial artery. If that patient doesn't have a good enough vein, or it's been used somewhere else, we do have plastic tubes that we can sew in, that we can use as those bypasses. So there are many things that we can do, but we try to do the least possible.
And again, you know, we were talking about doctors that are qualified to treat PAD.
Correct.
You have to be careful about who you go to see.
Your family
as
doctor,
well?
your family doctor can usually make the diagnosis and can do most of the kind of conservative treatments, exercise, diet, etc. But once you need an intervention, such as a balloon procedure or a stent, we even have lasers, all sorts of things that we can use, or a bypass, then that's done by people called vascular surgeons.
Okay.
So they're trained not only to do surgery, but can do the medical management and the balloons and other things.
All right. Now, depending on how severe the pad is, you recommend different types of procedures.
Correct.
Like when do you use a laser as opposed to doing,
Well,
a stint or
that's a
something?
secret. I'm not going to tell you.
Oh, you have to have it come and done?
But what we do is we have simple ultrasound tests that give us a good idea what treatment we're going to do. And then we may do what's called an angiogram, where we put dye into the blood vessels. And then the doctor makes a determination what type of treatment will be done.
Okay. All right. Tell us again where we can find you.
Sarasota Vascular Specialists, that's just off Cattleman Road or Fruitville Road.
Yeah.
And you can go to veinsandarteries.com and you will find us.
Great. Thank you. We'll see you again.
Look forward to it.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.